Hi everyone, this is BenZadeh. Um, this presentation is for our business plan. My group member Robert Keller and I put together this fictitious company to talk about a product and an idea that we believe can revolutionize healthcare industry. Uh, the so it's me and my partner. The name of the company is Telemedical, and it's basically a mobile health provider that our company provides remote patient monitoring to hospitals, nursing homes, and in-home patients. Um, the mobile health technology has been growing very fast. We can see that in financial sectors, in products such as mobile banking or finances, doing your finances on your mobile device. In health, we have seen new products in remote patient monitoring, remote research and diagnosis, and data collection devices. So if you pay attention, sometimes people who carry heart monitoring devices, these devices can relay information using the mobile infrastructure. What we seen in the last several years has been expansion of mobile internet access market. So, uh, in spite of growing mobile segment, penetration of mobile technology into healthcare has been minimal. Um, However, there are demands for uh, technologies or solutions that use mobile technology. One of these obstacles that has been shown and has been mentioned by practitioners is the increasing patient compliance. Practitioners, health organizations must compliant must follow rules and regulations set forth by Medicare, Medicaid, and other uh, uh, organizations. So there's a huge desire for physicians to use technology to um, monitor patients and be able to track patients, whether they're in the hospital or they are discharged and they're at their own home. Um, the physicians have shown increasing desire to use these systems, but in spite of their desire, for example, for tracking and monitoring patients, there has not been that many technology solutions, providers or companies that provide solutions that can help to resolve this issue. One of the issues that has been it's been very challenging for health organizations has been a number of bed falls and bed sores. Patients fall has been one of the largest risks that hospitals are facing, and any kind of preventive system that can prevent patient falls will be um, will be in huge demand. Our system uses our business plan is to provide a technology solution that can be used to prevent bed falls and can detect the probability of bed sores. We're gonna target healthcare organizations or any facility that provide long term care. The way that system works is we're gonna build a pilot program and we're gonna deploy that to Velastar for them to use, and that's how we're gonna start. Basically, the way the system works is it uses a spectator devices that sits on top of the patient's bed, and these devices collect infrared um, um, data and use the open source. We're going to use the open source software or platform called OpenCV to analyze the images and detect the patients when they leave their bed or when they fall off the bed. The images that are collected are in format of infrared, so we don't collect any kind of characteristics or facial descriptions or descriptive information from the patients. So it will only collects heat characteristics. And this technology has been around for in other sectors, so we're going to just basically use a technology that has been specified in other industries, and we're going to use that for this purpose. And we're going to use open platforms, which are and open source softwares. LIDAR is another open library platform that can be used for analyzing images. We will detect track motions, and we will detect when patients are not moving. We're gonna use the non-movements and detect the probability and analyze and come up with a probability that they might face bed sores. If they leave their bed or if they fall off the bed, we're going to detect that, and we're going to generate an alert to appropriate nurse. So the nurse will receive a text message with the image of the patient and the room number and the bed number and the status of the patient. In many cases, patients should not leave their bed, so this system can detect any kind of attempts by patients to leave their bed also. So this is basically the technology that the solution that we will require funds. The solution will require initial investment for development, and we're going to ask for $500,000 for development of the system. And then our revenue comes from monthly monitoring services. Basically, we monitor each bed for $1,500 a month, which will generate large cash flow for us, for our company. We're going to require a minimum of 100 beds to be monitored for our pilot system. So that's going to we're expecting to generate $2.7 million in revenue for 2013. And we're going to use venture capitalists. We're going to ask for that investment, and after 5 years, investors can get their money back by sharing their equities. We're gonna give 20% of the company for that $500,000 that we will receive. So this is you can look at the business plan paperwork. It's almost 20 pages. It explains everything in details. This is a very short presentation that we put together to explain the system. We wanted to do it short, so we don't bore you. Have a good day.